Okay, so welcome to week number 17. We are heading towards our journey of 26 episodes. And just after this one, 9 episodes are left, and I'm so excited to get freedom from these lives, from these weekly duties, of course. So, as usual, all my presentation always begins with thanking the Lord Almighty who's given me much more than what I deserve. So, this is my brief CV, courtesy my PG diploma in MLE from National Law School, Bengaluru. I'm sitting before you. You can say giving a word or so about the case that was being discussed. This was the case that was put up by Dr. Rajat Anand in my WhatsApp community group. So where he's one of the most active members and he keeps on posting every update every now and then. So this was the case. So let me just read out the case for you. So of course I'll skip out the names. The name of the patient who was facing chewing problems due to overlapping teeth approached dentist at XYZ hospital, which was owned and run by him. So, as advised by the dentist, the patient underwent root canal of four upper front teeth with metal ceramic crowns. So, the treatment caused disfigurement of her face. She learned that no x ray was taken, even though it was necessary to have a high quality, long cone parallel radiograph. What a word to use. Okay. Of course, it is the right word, but how come the patient using it? Never mind. So, of course, in this case, the journalist Miss Jahangir Ghai using it. So, before opting for a root canal, she alleged that three of her front teeth permanently got discolored, slightly missing, maybe discolored due to grinding or distorted due to grinding, and the other whiter teeth were killed. Later, the dentist gave plastic caps to these teeth, which I presume must be the temporary ones. However, this could not help, and she continued facing problems. The patient filed a complaint before the district forum alleging negligence, for which she sought a compensation of 20 lakhs. You might be wondering why 20 lakhs, because the mental trauma is valued very high than the physical trauma. Of course, it is covered under the criminal sections also of IPC 335, 336. So those sections are also there, but let's not shift our focus to that. Further continuing, the complaint was contested by the dentist, presumably, of course, stating that the patient had badly decayed teeth and it was not possible to perform orthodontic surgery as she was over 40 years old. So an endodontist, Dr. XYZ, was brought in for root canal treatment. It was denied that there was any negligence or deficiency in service. So the district forum referred the dispute to a panel of experts, two of whom opined that the treatment was proper, while one opined that the dentist had been negligent. Now, it is itself contrary. Based on the majority opinion, the forum dismissed the complaint. So means the two dentists, two of the medical board dentists were in the favor. So the district forum dismissed. But then, of course, everyone has the right to go to the higher authority. So she appealed to the AP State Commission, who held that the dentist was negligent for failing to take the X-ray. It also observed that no evidence was produced by the dentist to show that root canal should be performed on healthy teeth. So set aside the forum's judgment and ordered the hospital to pay rupees 5 lakh along with 9% interest. So there are a few things that I'll be discussing in this. Of course, there are just about 3, 4 slides only today because I've just written down the points because this case was shared in the morning. So whatever time I could afford from 7:45, I just shared in a few points over there, which I'll be discussing. So there are a few issues in this. Number one, the MLE consent part. Of course, the second is the record keeping snake and the clinical fancy scenario. Let me just break down these into smaller parts. So the consent issue, of course, when you are offering a intentional root canal treatment to an ortho case, you have to be doubly sure, or rather quadruply sure, I would say, in such cases. You don't know the psyche of the patient. The patient will say, I want the correction in my front teeth. And trust me, PFMs are never, never, never a good option to correct anyone's smile, especially orthodontically. Unless you reduce the teeth so much and you do a lot of intentional replacement and then you get it done from a really a good lab, you cannot have thin crowns. And of course, there in the interior, there the metal collar shining through them, and the shade issues. There are a lot many issues with the PFMs. So especially in such a case where the patient has come for such a thing. So I presume that the dentist claim in this regard that a preoperative, or sorry, preoperatively the teeth were decayed might be false. Might be. Again, I'm just presuming whatever the data is given to me. So I presume that might be false. So it is a case of an orthodontics because which was not started because of the age factor or whatever reasons mentioned in there, and that is the reason it was, you can say, started with an intentional root canal followed by crowns, with a good intention, with an honest intention to correct the patient's overlapping teeth or smile, to put it very simply. Now the record keeping comes in here. What is your reference point? There is a very common scenario. The patient not in this case, but any patient comes to you, doctor, I need a crown. I have already got the root canal done. I need a crown. Very, very rarely we ask, why did not you get a crown from your previous dentist? Very few of us ask. We are happy कि चलो अच्छा है, मेहनत का काम उसने कर लिया, इजी काम क्राउन का हम कर लेंगे, मलाई उसी में है, ठीक है ना? तो grinding means the grilling part has been done by the previous dentist. So we don't bother. Now the patient has come symptom free. Sometimes again there are two scenarios. You take out an X-ray after the patient's permission, of course, and you find the root canal to be dodgy or faulty, but the patient is having no symptoms. You advise the root canal. The patient says, "मेरे को कोई problem नहीं. Why should I get it done?" So in a hurry to start the treatment or in a wish to start the treatment कि crown वाला patient भाग ना जाए, we take an impression. Take an impression, insert the crown. Sometimes, probably later, 1 month, 2 months, 6 months, 1 year, the dodgy root canal fails or is clinically, you can say, evident as a failure. Now, the patient will say, I was fine without the crown. This crown is the reason for my pain. You will try a lot to stress upon. No, your root canal was dodgy. We told you. In this case, is again two scenarios. You taken a consent or not taken a consent. You taken a consent that the patient was advised, but he didn't opt for it. The problem, you didn't opt for it. You have the signatures, matter closed. You don't have a signature. How will you prove? In this case, the dentist could not prove that the patient had a preoperative problem. Probably the teeth were healthy. So let me come back to the original situation of this. The patient refuses an X-ray. No, doctor, कोई symptom नहीं, root canal is fine. Sometimes the problem develops after 1 week. Now you take an X-ray. There is a swelling. There is a lack of biting. You find the root canal is dodgy, and then you say, "आपकी root canal में problem है." After the crown निकालना पड़ेगा. So why didn't you look at before? Some people make that mistake also. Not everybody is clinically perfect. So there are a lot many things to set a reference point, to go according to patient's wishes, to go not according to patient's wishes, to fulfill your own EMI pocket threshold, or to, you can say, do an ethical treatment. There are a lot many scenarios. The unfortunate problem in India is there is जो busy है वो बहुत busy है. There is too much work with people who are busy, and the other category might be, you can say, जो free हैं उनके पास मक्खियां मारने तक का time. So there is a lot of disparity in that. Very rarely people are there who have just optimum amount of work, or they keep on filtering their work to keep it at an optimum level. Then the third scenario, and this is the clinical fancy scenario, the software scenario. I'm not against the softwares, but having burnt somehow get a hang of it, apart from the brilliant features they have, including the reminders, including a lot many features. I won't name it for the lack of time purpose, but there has not been even one software till date which has been able to give me a printout or a log or a Excel based or a PDF based or a Word based printout of my day book. Like a bank may have 10,000 accounts, for example. Let's suppose 100 of them have deposited money. Via a single click, the Finacle of the bank software prints out that these were the accounts that had transactions on a particular day. The software unfortunately can't do that. So using software for your own convenience, perfectly all right. Using making your staff train for that, perfectly all right. Having everything at your fingertips, using all the latest features of the technology, perfectly all right. But the law does not need a software from you. It needs a daily output. So if you are using the software and along with your daily output in the form of a register manually or digitally, any mode, then that is acceptable. But if you say only the software and no daily daybook record, just like the Form 3C format or a similar extended one, as I say, then that is a scenario. Because all these things are cross-linked with each other. The law mandates you to maintain a register D like format or a Form 3C like format. Extend जितना मर्जी हो लेकिन basic हो कि हाँ इस ये treatment हुआ, and of course the payment part, the receipt number part, all those things are to be done. So you need to factor in those things. Now let's come back to the case. We read this case. I've read this case. The root canal 4 upper done with 4 ceramic crowns. No X-ray was taken with a low, high quality long beam, long cone X-ray, and permanently disfigured. Grinding was done. Of course, if the tooth was decayed, nobody would have complained. But sometimes there is a later realization by the patient कि मैंने healthy दांत बिना बात के grind करा लिए, and I've ended up with this. Some patients intentionally don't get this smile corrected. We all have had such cases. Even I had many of them. They say my husband likes my crooked teeth. Of course, not in a wrong sense. I'm saying crooked teeth, but just the overlapping teeth or maybe crowded teeth or whatever. My husband likes it. I don't want to change it. Fair enough. So even if you find an issue and you advise it. So what are the problems in this case especially? The commonest errors, of course. The common errors again, I would say hurry in starting the treatment. What is the hurry? Not in this case particularly, but in every case, what is the hurry? If the patient has come to you, the patient will not run away. We feel that if you don't start or if you don't do anything or if you don't take an advance, the patient will run away. We are very much myopic in that regard. We need to have a telescopic vision in that. Then, of course, no reference point to start with. As I said, I gave you an example of root canal done by another dentist and you being taken or you being told to take over for the crown part. Now the root canal also belongs to you if you don't take a reference point. Or the crown is responsible for all the woes unless you clear out everything to the patient and get in return. You know it, but the patient doesn't know it. If you don't convey it before, the patient will believe later on that you are covering up. In spite of the fact that you are telling the fact. In spite of the fact that you are telling the fact. Then of course, the most important scenario, is it a case of a wrong diagnosis? It was an ortho case. Was an ortho consult taken? I bet no. The dentist himself does not seem to be an orthodontist. He is calling an endodontist. But if he was himself an orthodontist, he wouldn't have refused, of course. So if the dentist not taken a preoperative X-ray, I don't expect the consent also to be taken. Of course, it's not clear in the report given. Then the expectation setting. The problem is we sometimes promise too much. We don't mention that we have to grind your teeth to place the crowns. And trust me, for many, many patients, it comes as a shocker when you start preparing the tooth. We might mention prepare the tooth, reduce the tooth. They will say grind the tooth. And grinding means मेरा natural दांत घिसा के इतना सा कर दिया, छोटा कर दिया, बर्बाद कर दिया. That is the common scenario where the patients are not aware and where you don't make an attempt to make it clear to them, especially if it is a first timer with the crown part. The problem is in that expectation. Nobody would understand that the tooth is still 75 to 80% remaining. I presume that you are doing the normal part. Normal crown prep, still 65 to 80 or 75 to 80% tooth is remaining, the natural tooth. Some will say इतना सा रह गया, 20% छोड़ा, 80% आपने grind कर लिया. People will say it. People have that notion. So clarifying everything. You show the demo crowns. You don't tell the procedure how is to be done. If the patient already has had a crown, then it's a different issue altogether. Then they are almost aware of it. Still telling them is one thing. Then expectation setting. What if you were correcting the smile, if you were intentionally doing a root canal, of course, consent part, clearing part, telling part, why were not the zirconia crowns advised or metal free crowns advised, which at least can beautify? Even if you're following this plan, the first thing is, why are you following this plan first? Of course, let's suppose the patient agreed to the treatment plan, which I am damn sure the patient wouldn't have. Because if the patient created a lot of hullabaloo later on, it means that everything was not clarified first. The dentist got an idea that मैं इसकी smile design करूंगा intentional root canal and crown से. That is where the problem came. And leads to medical error only. And then over promise and under delivery. PFM crowns, as I said, unless using from the good labs, unless using really, you can say, high-tech stuff, you cannot have very thin, good crowns. And of course, even then they are thinnest, there will be still some metal shining from the buccal margins. Still some metal shining. Even though you place a shoulder over it, still there will be something. And or maybe they start showing over the period of time. Then the breach of trust. Of course, especially if there is an orthodontist on the board, he will say that the treatment is negligent. We need to address this part very clear. But the problem is the general dentists are not in sync with each other. The specialist dentists are hell-bent on sometimes, you can say, ridiculing the graduates or the UGs, or just the graduates, I would say, or just the BDS, I would say, with the umpteen humility, I would say. Many of colleagues do that also. So how can you expect an orthodontist who anyways are at the pinnacle of the specialties to act in favor of? Then, because why do I say the breach of trust part? Because words like high quality long cone parallel radiograph, this is not a patient terminology. The patient terminology is just an X-ray. The patient terminology is not even a radiograph. So high quality long cone parallel, IOP or whatever, is the dentist terminology. So somebody, an insider must be there inside. And of course, the lack of consent issues and the lack of record keeping issues are already there, which I've explained just now. So you need to understand that part very clearly. If you are not sticking to the template, the law is 100% against you. Remember that. Gone are the days when we were treated equivalent to God. We are not. We fall under the Consumer Protection Act 1986, and we are service providers and patients are consumers. It is as simple as that. Be it a noble profession, be it done something in good faith, you need to remember certain things done in good faith don't always go well or go down with the patient. I believe somebody has done intentional root canal followed by, and that too from an endodontist, followed by a PFM crown. He must have charged close to at least 25 to 30,000, which is again not a small amount. But then if it is not a small amount, in 30,000, the patient said, I will be like an Apsara. Probably the expectation setting was not right. And that is what led to a problem. If the patient had been told about all those things, I don't think this thing would have occurred. So the record keeping, reference point, consent thing, all these things need to be addressed pretty much surely, so that we don't land up in this kind of a situation. So what is my carry home gyan for today? Think twice before picking up an erotor, micromotor, or scaler. Anything that can cause any damage or even starting the treatment on the first day of patient, especially a new patient. Don't do it. Never ever do it. Even if the patient is ready to undergo the treatment. He might be just willing to get a treatment done because of the reason of pain, or maybe getting rid of the pain. Some of these patients are not even, you can say, you don't know what is their history to lignocaine. You are not sure. And trust me, guys, for a first timer, never ever start the treatment without a patch test. I still do a 48-hour patch test. You may call me overcautious, कि छाछ को भी फूंक मार के पीता है, but yes, I faced this once. One of my patients had a delayed hypersensitivity after 36 hours. And trust me, it happened almost 18, 19 years ago. I still don't have the confidence to touch a not previously exposed LA patient to LA in this situation. Colleagues would differ. They will say 1 hour is enough, 2 hours is enough, 4 hours, 8 hours, 10 hours. You're free to do it. I don't do it before 48 hours, frankly, especially where there is no previous exposure of LA. We all know what LA allergies can do. So why are you even bothering to start the treatment? So never be in a hurry to start before setting the expectations right, before setting the context right, before setting a reference point, before setting a record keeping, before explaining everything. And of course, the consent has to be there. You can't escape that. When there is a parallel option available, like it was available in this case, an intentional endo and rehab or prosthetic thing being done in lieu of the orthodontic treatment because of the age part that has been mentioned as an excuse or reason, whatever. I wouldn't say, I told you be doubly sure before picking up an rotor. Here I would say be quadruply sure from patient side that we are going to do this. We are going to drill a hole. We are going to reduce your teeth. We are going to move your teeth in this ways. All this will happen in less than a week. The treatment, that ortho treatment might take, whatever the context is there, you have to set that context right. And then give the patient a time to sleep over, discuss with family. And once they are ready for it mentally, then start the treatment after the written consent. The expectation setting has to be really optimal. Colleagues, start the treatment in good faith. You might be doing good for the patient. The patient might not find that good always. And lastly, never promise the moon or be highly skilled to do that. But even highly skilled can make a mistake. So don't promise the moon. You can do even a better job than what you tell, of course. You can give a better shade, you can give a better translucency than what you promise, but always be on the safer side. Now, I talked about the breach of trust. So unity is one another aspect which needs to be addressed. And I can't push colleagues to be united, be united. We are already fan of subject J and BB, as I always say, jealousy and backbiting. So you have to be yourself from within ready for being united. Any damn association, any damn, you can say, smallest puncture walas, rickshaw walas also have a union. We don't have it. Our own common point is IDA, and only platform available. A lot of parallel have been tried, but nothing works. People don't join because IDA corrupt hai, IDA ye hai, IDA wo hai, whatever they have reasons to give to not join. So enter there and clean the corruption. You can't clean IDA from sitting from outside if you have that notion. I'm not saying that is true or false, but that is a perception that people have. As per IDA HO data, only 25% are their members. 3.5 lakh dentists and only 75,000 their members. Only 25% people are united, and you expect IDA to do everything. You can't. The majority is outside. The majority is not inside. And of course, when you think of such patients, think of consent and not the fear of the patient running away. Because once you set a reference point, it sets so many expectations right. At what is to be done, how is it is to be done. So understand and read the patient's mind first, estimate the needs and the expectations, and then jump onto the Because unless you do that, you will be surely in a problem. In episode number 20, I had taken up a similar case shared by Dr. Rajat that was on warranty and everything. This is episode number 17. So in between also there was one case. So every alternate week we are having such cases, and these are the ones which are being reported because of the volume of the damages being awarded. But there are so many other cases which are not being even reported because of the damages or not damages. So think, think. That is what I want you to. The topic again was this only: the MLE consent part, the record keeping snake, and the clinical fancy scenario of softwares. We are so कि software में आ गया, सब कुछ आ गया, सब कुछ आ गया. Sometimes your X-rays are not even aligned with your software. Your X-ray software is separate and your clinical software is separate. Of course, many are now allowing integration in between, but there might be certain situations where the colleagues are still using an old software and an old software for RVG. So many colleagues are not even using the RVG; they are using still the films. The absolute limitation period is 2 years. 1 year of condemnation of delay is allowed. So anybody can file a case from 3 years from the starting of the treatment. Are you sure that you can preserve your X-ray films especially if you are living in a hot and a humid temperature? Most of India's temperature is hot and humid only. Except J&K, I don't find that there would be temperature, but there would not be heat or humidity. It's all over India. So how can you retain those films to be in a retained mode? And if that is your only starting or a reference point, I'm really not sure whether you're doing things right or not. So think of going digital. It is high time. All the gadgets, all the things around you are smarter than you. We human beings are getting dumber day by day. This is the world of AI, artificial intelligence, and we are not even digital. We are still sticking on to our pen and notes and handwriting and everything, wasting so much time on that. Just with an excuse कि मुझे कंप्यूटर नहीं आता है. कंप्यूटर नहीं आता, क्या एक्सक्यूज है? हम नहीं आता तो टाइपिंग का कोर्स कर लो, टेक्स 3 weeks ओनली. जस्ट द फियर ऑफ टाइपिंग ओनली. टाइपिंग का कर लो. रिकॉर्ड कीपिंग एटलीस्ट वो तो कर सकते हो स्टार्ट. हार्डली 1 hour क्लास पर डे. In 3 weeks you can be a typist, or at least you can do a decent amount of good typing. You don't have to be a steno to someone. Don't give me this excuse. There will always be an excuse for not doing the task. That is not the answer. It is a digital era. Adapt yourself. Still people say मैं बुक में से पढ़ सकता हूँ, मैं PDF नहीं पढ़ सकता, मैं नोट्स में ही पढ़ सकता हूँ. अरे कम ऑन, कोई भी नहीं पैदा हुआ था हम में से जब डिजिटल चीजें आई हुई थी या नहीं आई थी. If I have adapted, if many others have adapted, why can't you adapt? So stop giving yourself these excuses. These are only preventing you from growing. You're using your phone for typing, but you are not using a computer or a laptop in your clinic. That is a weird excuse to give. Absolutely weird. Think about it, what I've just told you. Because unless you put yourself in think mode, you cannot get the solutions. There will be such cases reported. Pray that you are not reported in one such case or any of such cases. Unless you adopt the right ways, unless you learn the right methods, only God can save us. Only luck can save us. Or only blessings of parents can save us. If I have disturbed your night sleep, jap naam, jap naam. Thank you so much for your patient hearing. So this is my WhatsApp community where Dr. Rajat shared the case. So I have 2 communities. Of course, these are advertisement-free groups. 6th group is on, and I plan to wind them till 6 months. This is my YouTube channel. This video will go tomorrow on YouTube. If you have not watched previous episodes of Miraculous Mondays or Thunder Thursdays, all of them are already uploaded over there. Feel free to watch or not, your choice. So do send me your feedback. If you find anything worthwhile in this video, bouquets and brickbats both would be welcome in equally. So thank you so much once again, and I stop my share for questions or acknowledging visitors on my FB page where this session is happening. Hello, Dr. Brinda. Hello, Dr. Ramchandra. Hello, Dr. Lalit. Hello, Dr. Gurdev Singh Bali, sir. Hello, Dr. Rajat. Your case was was the starting point for today's discussion. So, hello, Dr. Rajendra Desai. Hello, Dr. Bharat Gowda. Hello, Dr. Manu Bhavra, sir. Hello, Dr. Nikhil. Hello, Dr. Sunehra Nurani. Hello, Dr. Parneet Nair. Hello, Dr. Vandana. Dr. Lalit says for hot cold sensitivity, RCT require as intentional RCT to be mentioned and take consent. Yes, surely. If you're doing something which is causing grinding or delaying, or you can say making anything whole or something in that tooth, you need to be very sure and confirm it. So, hello, Dr. Aditya. Hello, Dr. Gaurav. Thank you, Ramchandra sir. Thank you, Dr. Mayur. Thank you, Dr. Lalit. Any questions? I'm here for 2 minutes. Please feel free to ask. You can type your question in the chat. I'll answer them. Thank you, Dr. Rajendra Desai. Okay, then, guys. Thank you so much for watching. I'll be back on Thunder Thursday with episode number 17 and with episode number 18 of Miraculous Mondays next month. So stay tuned and be there. Same time, 8:15, 8:20. Thank you. Take care and have a great week ahead. Bye bye.